General compliance training is presented by DCH Internal Audit and Compliance Department and is produced by DCH Health System, Tuscaloosa. Compliance is an internal program to encourage ethical conduct in daily operations and a commitment to adhere to internal policies and procedures as well as external laws and regulations. It is designed to prevent accidental and intentional violations of laws, regulations, and policies, to detect violations if they occur, and correct and prevent future non-compliance or improper actions. DCH is committed to honesty, reliability, trustworthiness, and integrity as part of our mission to provide quality health services to the communities we serve. DCH employees are expected to perform their job responsibilities correctly, ethically, and legally. You should have avenues available to report business that is not being conducted properly. You shall participate in reviews, investigations, or audits, whether conducted by an internal or external agency. You can learn more about DCH's Standards of Business Conduct and Conflict of Interest Policy on the DCH intranet. Everyone is responsible for compliance. The DCH Board and CEO, Internal Audit and Compliance Department, supervisors and managers, employees throughout the system, volunteers, physicians, vendors, and contracted services. Compliance is everyone's responsibility. Do you know what you should do if you have a role with another company or entity that may pose a conflict of interest? Any potential conflicts of interest should be disclosed to your supervisor, and a conflict of interest form should be completed and approved by your supervisor, the Corporate Director of Internal Audit and Compliance, and your Vice President, as well as the hospital administrator. Did you know that healthcare is the most heavily regulated industry in the United States? It's regulated because of the potential for fraud and abuse. Who can investigate or audit us? The Department of Justice, Centers for Medicare and Medicaid Services, CMS, the Office of Inspector General, the OIG, the Federal Bureau of Investigation, the FBI, the State Attorney's Office, State Board of Public Examiners, and OIG, RAC, UPIC, MAC, MIC, HEAT, and OCR. DCH's mission and vision, along with its core value of doing the right thing, means DCH will not tolerate fraud, waste, or abuse. Those are some terms you need to know. Fraud is a false statement made with knowledge that is false and could result in some undue benefit. Waste means specific overuse of services or causes of unnecessary costs. Abuse refers to general practices that are inconsistent with sound business, financial, or medical practices. Some examples of fraud, waste, and abuse are billing for services or supplies that were not actually furnished, falsifying information, selling a patient's protected health information, charging different amounts based on the patient's insurance coverage, providing services to a patient that were not necessary in order to obtain reimbursement from the patient's insurance. You might ask, why do I need to know about fraud, waste, and abuse? Remember, we are all responsible for compliance. You will be asked to complete a compliance attestation on an annual basis. Some other things you need to know about are the False Claims Act. This prohibits knowingly submitting a false or fraudulent claim to the government. The Anti-Kickback Statute. It prohibits persons from offering, paying, seeking, or receiving anything of value to bring about a referral for medical services. Violations can result in exclusions from federal programs such as Medicare and Medicaid, and monetary fines and penalties can be substantial. The government recommends compliance programs, and there are 7 elements strongly recommended by the government for an effective compliance program. These elements were issued by the Office of Inspector General, or the OIG, and are as follows. Standards of conduct, policies, and procedures. Oversight and accountability. Training and education. Monitoring and auditing. Reporting and investigating. Enforcement and discipline. response, and prevention. Let's take a look at element 1, policies and procedures. Examples include policies and procedures related to the Emergency Medical Treatment and Active Labor Act, or EMTALA. This requires DCH to provide a medical screening examination when a request is made for examination or treatment for an emergency medical condition, including active labor, regardless of an individual's ability to pay. Password usage, including proper procedures for maintaining the security and privacy of patient information. Remember, never share your password with others. Unbundling or upcoding. These are examples of manipulating claims information for increased reimbursement. They are strictly prohibited under the False Claims Act. Gifts and gratuities, which prohibit soliciting or accepting anything of value from any provider of healthcare services or products, with the exception of specific situations outlined in the policy. Element 2 is oversight and accountability. Compliance is everyone's responsibility, and a designated compliance officer oversees this program. Element 3 is training and education. DCH requires all employees to complete initial compliance training upon their hire. Additionally, all employees are required to complete an annual refresher course via computer-based training, or CBT. DCH may also provide training and education through live sessions and/or electronic communications. Employees can also reference the Corporate Compliance section in the Employee Handbook. DCH will follow all laws and regulations with an emphasis on doing the right thing. Element 4 is auditing and monitoring. DCH has an ongoing program for auditing and monitoring DCH processes in accordance with a risk assessment conducted annually. Element 5 is reporting and investigating. DCH has established lines of communication for compliance issues, including an open line of communication between the Compliance Department and all DCH employees. DCH has an anonymous hotline at 1-877-847-4324. DCH has a non-retaliation policy to protect anyone who makes a report in good faith about a potential compliance, fraud, waste and abuse, or ethical issue. Element 6 is enforcement and discipline. DCH is committed to being fair, equitable, and consistent when enforcing the standards of conduct and policies and procedures. What is the number one reason people are non-compliant? They did not know the appropriate choice to take. Remember, at DCH you have resources available to you: your supervisor, legal department, human resources, compliance, and the DCH hotline. Element 7, response and prevention. DCH is committed to responding to alleged misconduct, reporting findings as required, and preventing future non-compliance. The following words and phrases are warning signs about potential problems. When in doubt, always seek assistance. Here are some examples. Well, maybe just this once. Everyone does it. No one will ever know. No one will get hurt. Don't worry about policy. Rules are made to be broken. Hear no evil, see no evil, speak no evil. If you hear these things, seek assistance when you're unsure. Compliance is important. DCH must be compliant to stay in business. Compliance ensures our viability. It helps us maintain a positive reputation in the community. Our focus on compliance underscores our core values of honesty, integrity, transparency, and accountability. Correcting compliance problems on the back end costs money and resources. DCH is committed to improving the health of the communities we serve by providing care with exceptional clinical outcomes and patient experiences. To realize this vision, DCH must develop and maintain a relationship of trust with our patients. Media headlines regarding non-compliant behavior can jeopardize that trust and influence patient decisions on where they seek to receive healthcare services. Therefore, it's imperative that we maintain a culture of compliance, honesty, and integrity as part of our mission and vision. We want to be a headline for the exceptional care we provide to our community, not for non-compliant behaviors. For more information, you can always contact Brent Freeman, Corporate Director of Internal Audit and Compliance, Joanne Nichols, Senior Clinical Compliance Coordinator, or Rosie Rutley, Compliance Manager. Their contact information is on your screen now.